News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. This month we're going to continue to take a look at important healthcare topics in our community, and we have two wonderful guests who have come to share their wisdom and expertise with us again this month. To my immediate right is Dr. Amy Kahn. Dr. Kahn is the Chief Medical Officer at St. Mary's Health Plans. Dr. Kahn is a primary care physician with additional certifications in preventive medicine as well as addiction medicine. She has worked in many diverse populations with various healthcare systems to help assure the delivery of quality care and enhance conditions that improve health practices. Dr. Kahn, it's so good to have you back here on New Skills for Living.
Thank you, John.
Yeah. And to my far right is Peggy Knipp. Peggy is a registered dietitian with more than 20 years in the preventive healthcare arena. She holds a master's degree in nutrition and manages health and wellness services for St. Mary's Health members. She has worked extensively with individuals and populations to improve health behaviors and optimize health outcomes. Peggy, thank you so much for being with us here today on New Skills for Living.
Thanks, Tom. It's good to be here.
So you guys have chosen a really interesting theme or description for describing healthcare in the 21st century with us today. And it's called Piloting Your Health, Who's Flying Your Plane? Amy, would you tell us a little bit about that title and what that means in terms of healthcare?
Sure, Tom. And again, thank you for having us.
Yes.
The topic is really about thinking about and considering your life's worth as it relates to your health, and specifically being actively engaged in your healthcare decisions, not only your health practices, but your healthcare decisions. What do you do on a daily basis, on a weekly basis, throughout time, to basically make sure you're going to have a great takeoff and landing,
yes,
to make sure you can soar and enjoy the ride along the way.
Yes.
It's really about taking steps to be more active and being the pilot of your own health.
Yes. And so as you describe that, it makes me think about quantity of life as well as quality of life. As a physician, would you tell us your perspective on that, please?
Certainly. And in the United States, our healthcare spend is arguably one of the highest in the world. But the amount of healthcare that you get, or the amount that you spend on healthcare, certainly doesn't determine your health, your quality of life, or necessarily your quantity of life. What we know is truly important is what you did yesterday influences your health today,
yes,
and what you do today has every bit of influence on what happens tomorrow. So really important to take a look at things like your diet, exercise, relationships, how you manage your stress. What's your environment like? Are you fulfilling some of those things that are valuable to you? And absolutely, access to health care and getting necessary health care are critical along the way. It's important as your own health pilot that you take steps to assure that those things are being taken care of.
Yes. And so as you describe that, it makes me, Peggy, I'd like to ask you then, what are the consequences of poor lifestyle choices that we can make?
Great question, and I think most people are probably very aware of the consequences of perhaps eating too much. Too many calories, of course, are going to result in overweight or perhaps obesity. Not exercising, you're not going to reach your full potential in terms of physical abilities. Those kinds of things I think people are very aware of. I think sometimes what we don't think about is perhaps what Dr. Kahn was alluding to in the quality of life.
Yes.
Okay, what's your life going to be about while you're on this journey? And if you're not taking good care of yourself and making those good healthy choices along the way, then your quality of life is going to be rather poor. And so the consequences may impact things that you might not even think about. For example, if you really value spending time with your grandchildren, well, if you're not physically able to do that because you haven't been exercising and you have a bad back or something like that, perhaps gaining too much weight now may result in a knee replacement down the road. Those kind of things that we might not think about immediately or in front of us, I think is important that we do start focusing on.
Yeah. It can also affect self-esteem and relationships. Can you tell us a little bit about that, Peg?
Oh gosh, yeah. There's an emotional impact of not taking care of ourselves, and it's different for different people. We all have different value systems, and I think about things simple as maybe not taking care of your teeth.
Yes.
How do you look in the mirror?
Yes.
How do you what's your perception from other people? And emotionally, you may feel really uncomfortable in certain clothing or in seating arrangements, that sort of thing. And socially, you may not be comfortable interacting with others if you haven't taken good care of yourself.
So we have about 30 seconds, Dr. Kahn. Is there anything you could add to what Peggy was saying?
Yeah, absolutely. Sort of in the realm of taking action around some of the things that are under your control. So with respect to health care decisions, is making sure you know what's recommended. Should you get a flu shot? Do you need a cancer screening? Have you hit that point in your life where there might be a certain type of blood test that's required or some other type of service? It's really making yourself available to those sort of services.
Okay, that is some excellent information, and right after this brief break, we'll continue with this important topic. Hello, and welcome back to New Skills for Living. You'll see up on your website up on your screen, the website, www.easeap.com. You'll be able to see in streaming video this interview with Dr. Kahn and with Peggy Knipp, as well as 30 other healthcare interviews on the website. So just go to that website and you can watch Dr. Kahn and Peggy talk about this topic, and you can let family members and friends know that it's available as well. I also want to point out to you that on the website, there are over 90 newsletters that you can access, you can download or share with friends, dealing with stress, depression, anxiety, relationship, when to be concerned about children's physical health or mental health. So now let us go ahead and return to our guest and to this topic. And you guys have chosen the really interesting metaphor that being actively engaged in our health is very similar to piloting our own plane. And Dr. Kahn, would you like to go ahead and expand upon that further?
Sure, absolutely, Tom. In the aviation industry, much of what pilots do involves, standardized practices that repetition has been engaged to be able to assure that no step is missed, and certainly has been effective in mitigating risks, so that whereas pilots can't anticipate everything, they can certainly be ready to make changes and adapt based on the fact that they have gone through a very specific checklist, if you will, to assure that they are going to have a great takeoff, great landing, and great flight. Similarly, we can develop health habits that in fact help us forge a path so that we can soar in our own lives. And so it's this idea of thinking about doing things in repetition, making deliberate steps, taking action to assure the best possible outcome.
Yes. Peggy, what would you like to say to expand on that?
Well, first I'd like to say that I'm not a pilot. I have never flown a plane, but which brings up the concept of learning. You really need to learn, of course, if you're going to fly a plane, learning about it. And the same is true of your health. Learning what's important to look for, learning what symptoms mean, learning what tests you might need at certain ages, learning about your health and learning your numbers, know your numbers, that sort of thing really is important in terms of taking care of your own health. And I think another thing that comes to mind is filing a flight plan. I know that pilots need to do that before they take off, and so the same would be true of your health. You have to plan. Plan what you're going to do. For example, if you know you need to lose some weight, you need to have a plan in place. How are you going to do that? If you're going to stop smoking, what are the resources available to you? What can you do in terms of making a plan to change your behavior and make better choices?
I think along those lines, it's really accessing the available resources. And similar to a pilot who might be learning new skills or maintaining currency, throughout our life, we're going to need different things along the way. So it's being sure to know, what's right for me at this time in my life. Exploring opportunities on some of the great websites out there. Medline, a public website where you can get health information. Perhaps you look at your within the community through schools or various programs, through your employer, potentially through your health insurance, where you have opportunities to get coaching, get education, find out what other resources are available to you, is very important. And I think along those lines, it's really valuable to consider an advocate along the way. Let's say I'm being diagnosed with a problem that I don't know much about, but someone else does. Making sure that you can talk to your clinician or your healthcare partner along the way, whether it be a physician, a nurse, a counselor, to be able to assure that you're getting the right care at the right time, making sure those resources are known to you.
And the other thing I'd like to add to that in terms of communicating, communicating your plan, if you will, is having that accountability. And that can be done through health coaching, something like that, so that you're being held accountable for your plan. A pilot would never take off without letting someone know where they are. So we would do the same with our health. We want to communicate our plan so others can help us along the way.
Yes, and we want to end there, but we want to pick that up right after this brief break. Hello and welcome back to New Skills for Living. We're talking with Dr. Amy Kahn, who is the Chief Medical Officer at St. Mary's Health Plans, and Peggy Knipp, who is the Manager of Health Management Plans at St. Mary's Health Plans. We were talking about filing a flight plan, and Peggy, would you go ahead and follow up with that analogy?
Yes, in addition to filing the plan, we always want to do a visual inspection. You think about an airplane being very carefully inspected prior to takeoff. They walk around their plane, literally put their hands on everything. And I think that's important in terms of ourselves. How often do you look in the mirror? When was the last time you weighed yourself? Those kind of visual inspections. Take a look at your teeth, those kinds, and self-exams that are recommended by physicians. Those kind of visual inspections of yourself, and certainly being aware of symptoms. Gee, what doesn't feel right? Perhaps that something's not quite right. Most people know, their own body and how they feel. So I think that's an important aspect of self-care.
Along those lines, I think it's important that people check in with themselves. How am I feeling? How's my mood? How's my energy? Are you getting enough sleep? I think that's very important to recognize. There's turbulence in our lives, and it comes in various parts and times in our lives. We've got to be aware of that, and what do we need to do to take care of ourselves to manage that. One thing within the aviation industry, and pilots go through a pre-flight checklist. What is your checklist? What does that look like? Do you have a relationship with a primary care doctor? Are you getting your blood pressure checked? We know that during, again, different periods of our lives, there may be specific tests we need to have or might consider having, or perhaps we have a family history that we need to make sure we're keeping on top of. Clearly, as we get older, we're more at risk for developing disease, and diabetes, for example, is very common. Hypertension is very common, if you will, as we get older. And so it's important to stay on top of that. As a diabetic or a person with high blood pressure, I need to know what I can do to help control that. How can I prevent that from becoming more complicated or more advanced? And so this idea of really assessing oneself through a series of checkups is important. Maybe there needs to be a little adjustment. Unlike in a plane where you're literally having parts replaced, we really want to say, hey, we don't have parts we can replace. We've got to make what we've got work, and we want to take care of that.
Well, it seems like a theme that I'm hearing, a couple themes really, are personal responsibility and active engagement.
Exactly.
Would either of you like to talk about that for a minute, this idea of personal responsibility and being actively involved in our own health care?
I'd like to say, just because I think about this as far as flying, the analogy or metaphor of flying a plane is, you know what, you're the pilot, you're not the passenger in terms of your health. And I think that's what's really important. You really are in charge and in control. You can't expect others to fly your plane, if you will, and I think that's just one of the really important things to think about in terms of taking that responsibility and learning, educating yourself, some of the things that we've mentioned already, really taking charge.
Where would you like to go next, Dr. Kahn, in terms of what you'd like to share with our audience about what's important with all of our health care?
I think what's really important to make sure we talk about is the consequences of not being an active participant.
Okay.
I think it's really important to consider that by not taking action, we may lose the opportunity to actually prevent disease altogether, or the opportunity to be able to expand our life or to be able to fully achieve the things that we want to. And so in that regard, I think it's important to think about prevention, primary prevention, secondary prevention. By not getting a cancer screening, I may be diagnosed with cancer at a later stage, at a point where it may not be curable or even treatable. So I think it is a very important piece to be thinking about in terms of taking action now, today, both personally in terms of health behaviors, but then in the choices that we make about whether or not we're going to seek additional care, screening, counsel, etc.
Yeah. What would you add to that, Peggy?
I think, again, so many people know the consequences of poor choices, but I think thinking...
But we can fool ourselves, though, can't we? We can be in denial, or we can minimize it, or say it's not going to happen to me, or
absolutely.
I'll deal with it tomorrow. Or
absolutely, yeah. The denial is a big piece of that, and I think it's so important to obviously not do that. But I think thinking beyond the actual perhaps tests, or oh my gosh, I have to get my blood pressure checked, or those kinds of things. I think if you can personalize it in terms of what does it mean if I don't do this, in terms of spending time with the grandkids, or walking my daughter down the aisle at the wedding, whatever it may be, whatever's important to you. What do I value? I want to be riding my bike when I'm, 60 years old, or whatever it is. I think that's what's important. If we can visualize ourselves and what we like to do and what's important to us and what we value in life, then I better take care of myself so that I'm able to do those things and participate in life.
That is excellent, and we're going to return in this next segment and really kind of wrap this up and listen to Dr. Kahn and Peggy Knipp share their wisdom and their expertise with us. Hello and welcome back to New Skills for Living, as we're in this last segment with our two experts with St. Mary's Health Plans, Dr. Amy Kahn and Peggy Knipp. Would you guys want to go ahead and talk with us then about this balance between personal responsibility and accountability and engagement, but then also like healthcare organizations like St. Mary's Health Plans that are there to support people in learning more about their health care and being more healthy?
Certainly, and thanks for the question, Tom. I think it's really important that if you have health insurance, and many or not most will in the near future, is that people take responsibility for knowing what their benefits are, knowing what their responsibilities are as a patient, making sure that they're communicating health concerns, but also availing themselves, as I said earlier, to some of the other services to make sure that they're informed consumers. I think with respect to the healthcare spend, we need to control that spend. We can't just have unlimited amount of money going to spend on healthcare. I think it's very important that our members are aware of their choices, their options. If a particular procedure or medication or surgery is recommended, real important to talk with their doctor about, hey, what are my options here? What are the outcomes? Is that going to make a difference? Peggy, in your area, I know you've done a lot of work around member engagement.
We have, and I think it is important to pick up with what you're saying in terms of members being aware of what the benefits are. And with health management, we have some great benefits for our members in terms of health coaching. We help people in the grocery store make healthy choices on grocery tours, and different opportunities for people, again, as a benefit to the members, where they can come and really engage in their own health care and maybe change behavior, improve their behavior. So,
can you tell us a little bit more about this coaching process or mentoring, or?
It's actually health coaching, health and wellness.
Coaching,
Yes, all of us on the health management team are certified health and wellness coaches, and that really means a one-on-one relationship with someone who can hold you accountable and help you, coach you through the process of changing health behavior. Perhaps you want to quit smoking, perhaps you want to lose weight, perhaps you want to manage your diabetes a little better. Those kinds of focus areas can really be helped along the way, if you will, with a coach, just somebody alongside you to sort of cheer you on in making the changes, helping you support your goals in that process of making the change. Change is never easy, regardless of the area. So again, just having that support and help.
You know, along those lines, Tom, I think one of the other pieces is many people are already ill. Perhaps they have a chronic condition. Again, we mentioned diabetes, high blood pressure earlier. I think it's really important that people have an advocate. If you get ill, if you have a complication related to disease, you end up in a hospital, emergency department, really important to have someone who also can help assist you navigate through the system. In a situation where someone might have a very severe illness who may need to go to an academic center, a tertiary care facility, important to know where can they go, what are their options, what can they expect. A very important piece that we as a health plan provide to our members so that they're getting, again, the right care at the right time.
Yes.
Driving value in that relationship is important, and clearly that patient-provider relationship or healthcare team relationship is critical in that process.
Yes, and so as you're talking about the healthcare team, I'm thinking of that cliche that says you alone can do it, but you don't have to do it alone.
Exactly.
So Peggy, can you tell us a little bit more then about you don't have to do it alone, that there is some support and some encouragement as well as some professional expertise offered to patients?
Absolutely, and we do all of that through our health plan, and again specifically through the health management department, but certainly not alone. We think of our members as part of the team.
Yes.
And I think that anyone, regardless of their health plan or scenario, should think of their health care providers as part of the team. They're part of the team as well. So I think encouraging people to engage with their primary care physician, engaging with their dietitian or their health coach or whomever is providing that health care or helping them along the way, again, just consider themselves a part of the team.
Yes, great. Dr. Kahn, we have maybe about 20 seconds or so. For people who have been watching the show and they're following what you and Peggy have been saying, what's one final thing you'd like to say to our audience?
You know, I'd like our audience here today to know that it's important for one to consider their health and remember that they're the ones who can be in charge of their health. Take responsibility for that, and that the value of their health isn't only as it relates to them, but the value of their health to their family, to their employer, and to the community.
That is excellent, Dr. Kahn, and we want to thank Dr. Kahn and Peggy Knipp for joining us, and we ask you to join us again next month as we continue to examine new skills for living.